One of the frustrating experiences that I've had while going to a doctor's visit is having my blood pressure taken. And what I have learned and have seen that there is no system, there is no process. Now, have you ever experienced going into the doctor's office, they call you from the waiting area, or they're talking to you the whole time, and soon as you get to the back, whether the scale is there or the blood pressure monitor is there, they put this cuff on your arm and they take your blood pressure, whether they do it manually or by machine, and I'll talk about that in a minute. But you get this crazy number. Now, if you're someone like myself, I take my blood pressure at home. Not because I have a blood pressure problem, but because I know that high blood pressure is a silent killer. And most people do not know or become aware that they have high blood pressure until either they have a heart attack or a stroke or some type of acute issue that happens that leads them down the road. But if you're walking around with high blood pressure, you will do years worth of damage before it is found. Okay, so if you monitor your blood pressure at home, just simply take your blood pressure in the morning, get a reading, and so that way you'll know your baseline. So when you do go to the doctor and they give you this crazy number, you can look at these people like, what is this? This makes absolutely no sense. So today in this video, I want to talk to you about why it is important to know your numbers and why the doctor's office, even yourself, may be taking your blood pressure wrong. So let's get into it. Like I said, for me, I take my blood pressure every morning. I have an Excel spreadsheet where I document my numbers, my pulse, and if need be, a lot of times I take this documentation into whatever doctor visit I'm having, right? But it is very frustrating, like I alluded to earlier, when I go into a doctor's office and either my blood pressure is taken by machine, which usually is more accurate depending on the quality of the machine, or someone takes it manually. Oftentimes now you don't see people taking manual blood pressures anymore because of the accuracy issue, but either way, whichever way it's taken, and oftentimes even the nurses or even the doctors will tell you it's normal when you know that your systolic, which is your top number, or your diastolic, which is your bottom number, is high. And what concerns me is they put this in my chart, right? And your medical record is a living, breathing document, right? And so say for instance, for whatever reason you need insurance, but they pull your medical records from your doctor's offices, and then they find out that you look like you're pre-hypertensive because you're going into the doctor's office and this is the reading. That's concerning to me. Most people don't go back and correct their medical records. Most people don't know how to do it, but most people don't do it. So this is a living, breathing document. One of the things, and I hope at some point that I can find a nurse or a doctor who's willing to go through the steps. What is the proper protocol on taking someone's blood pressure? I've asked this question in doctor's visits for myself. I get a variety of answers and responses. Sometimes your feet is dangling off the floor. Sometimes your back is not sitting against the back of the chair. And again, I shared earlier about them walking you from the waiting room, sit you down, and they put a blood pressure monitor on you, or they're talking to you the whole time that they're taking your blood pressure. All those things can skew your numbers, right? Whether your arm is up or down, whether it's level with your heart or not, all those things can skew your numbers. I'm sharing this video with you because you need to know the difference. You're not going to necessarily get educated when you go into a doctor's appointment, but you need to know the difference. Why? Okay, your blood pressure can affect whether or not your brain, so that could possibly be a stroke or your memory. Your blood pressure can also affect your kidneys. A lot of people that you see on dialysis either had high blood pressure for a long period of time, or they're diabetic and they didn't know it for a long period of time. Very, very dangerous. That can affect the filtration and the long-term function of your kidneys. It also can affect your metabolism. It can link to insulin resistance and prediabetes. A high blood pressure is just like a check engine light in your car, if you get that analogy. And if you come from a family who has a history of high blood pressure, strokes, heart attacks, and things like that, it is your responsibility to know your numbers. It's yours. You don't need to wait until you have a medical emergency to do something as simple as checking and monitoring your blood pressure. And I'm going to share with you the blood pressure monitor that I use. So if you want to get one at home, you can monitor this yourself. It comes with an app that will transfer the information over to your app. So if you go out to the doctor's office, you'll have it there, and you can make it easy for yourself. I have it set up in a certain part of my home. I get up in the morning, and that's really the first thing that I do. Okay. And so secondly, I said earlier that high blood pressure is a silent killer. It is. Most people do not have symptoms until the damage is done. High blood pressure causes cardiometabolic problems such as heart disease, type 2 diabetes, fatty liver, and tracking your blood pressure can help you identify if you have any risk factors early. You'll be able to see a trend if you're tracking your blood pressure over a period of time, which is a great thing to do. It doesn't take a lot of time, less than 2 minutes probably to do it, if you just have it set up in one place in your home for yourself. As I shared earlier, my mission is to optimize my health and performance while reducing my reliance on the healthcare system. And I can do that by checking my blood pressure. Buying a simple monitor, to me, is more advantageous than me having to run back and forth to a doctor visit or being on blood pressure medication, because it's a crapshoot once you get on that stuff, right? I'm pretty sure all of us know someone who is or has been on blood pressure medication, and it typically causes so many other problems. So I want to share with you what the American Heart Association gives as the appropriate numbers or the ranges for a good or normal or abnormal blood pressure. I'm going to share that with you also. And also I want to help you to understand how to measure your blood pressure correctly. All right, so here I'm at my little setup for my blood pressure monitoring section, and I'm going to show you how I do it. It's very simple. If you buy one of these monitors, they have instructions. It's very easy to follow. Your 3 or 4 year old probably could do it, but I'm going to show you. So I take and put on the cuff. This is based on the instruction of the monitor that I have, and the cord of the cuff is going down the middle of my forearm. Okay, so I don't have anything on my arm that is fitting over, and then you adjust it, and I usually take my chin and help me assist me. And you see here, and I either rest my arm here, and sometimes I rest it on my lap. But as you can see, my back is against the chair. Okay, so I'm going to rest my arm here, and then my machine has a button. Let's see, you can see it. It has a button right here, a start and stop button. My back is against the chair. Right, so I'm sitting upright, my back is against the chair. I have my arm here on the armrest. Sometimes I put it up on the stand where I keep my blood pressure monitor, and then sometimes I take it and put it and rest it on my leg. Okay, follow the instructions on your specific monitor. That way you'll have the best results. Then I hit the start button, and the machine now is inflating the cuff. I don't know if you can tell in the video that the cuff is getting larger. It may not be that detailed. Okay, for the sake of this video, I did not follow the exact instructions based upon my particular machine. Number one, it tells me to sit so many minutes and not talk. Obviously, I'm talking while this is going on. I have my reading 104/78, which is really, really good. My pulse is 68. So there you have it. It's not a big deal. I would just say if you're going to get a monitor at home, just make sure you follow the specific instructions for that monitor, and I will share with you in the link in the description the monitor that I use.